Hello friends, I welcome you all to my YouTube channel. I am Dr. Krishna Chaudhari, practicing at Cosmetic Laser Surgery Center, Prasad Chambers, Karve Road, Pune, India. When the skin is injured from a cut or tear, the body heals by forming a scar tissue. The appearance of the scar can range from nearly invisible to very obvious disfiguring. Unattractive scars can be wide, sunken, red, raised, irregular, pale, or even cause distortion of other parts of the face like eyes, lips, nose, eyebrows. A facial cosmetic surgeon has many options for treating and improving facial scars. The various surgical techniques for scar revision are designed to make the scar as smooth and as invisible as possible. This can involve recreating the incision, moving the skin around, or even moving the scar itself to make it less visible and filling the defect. What would work best for your specific scar will depend on where it is located and how it looks. Some scars, especially when raised, may be improved with CO2 laser resurfacing. These are methods to make rough or elevated scars less prominent by removing part of the upper layers of skin with laser light. Clearly, the scar will remain but will be smoother and less visible. Keloid or hypertrophic scars are often treated first with injection of medications to reduce the size. If this is not satisfactory, the scars can be removed surgically and the incisions close with fine stitches, often resulting in less prominent scars. One can expect to feel some discomfort after facial scar revision. Some swelling, bruising, redness are generally unavoidable. It is important for you to follow aftercare instructions for healthy and rapid healing. Though the sutures will be removed within first few days, your skin needs time to heal. Friends, today I am presenting a case of facial scar on lower eyelid and cheek junction treated by CO2 laser and fat grafting. This 25 years old girl met with an accident 10 years back. Scars and depressions due to loss of volume have become more prominent cosmetically and unacceptable. During consultation, I explained to her that scars will not go away totally but improve and less visible. Patient needs to have realistic expectations, particularly in this type of surgeries where things can be improved but not cannot be totally eliminated or brought to natural state. I use CO2 laser and fat grafting to improve her appearance. Friends, please watch before and after photos and treatment. If you have any doubts or questions, please do not hesitate calling me or WhatsApp 937-350-4565, or my email is cosmeticsurgerypune@gmail.com, and please do visit my website www.cosmeticsurgerypune.com. Thanks friends. You can appreciate the type of scar. It is starting right near the medial canthus, extending down circularly at the junction of lower eyelid and cheek and ending towards again lateral canthus. It is treated with CO2 laser, 5 sittings, 3 weeks apart. See the improvement. Then it was followed by fat injection. Fat was aspirated, filtered, processed, and PRP was added and injected in lower eyelid and also part of the cheek because hollowness was there. From 3 angles, fat was injected, so that gives better results. You can appreciate post-operative result. Total treatment duration was 3 months. This photo is after 1 year. She had come for follow-up. Hollowness has gone. Scar has become very shallow and narrow and less obvious. Thank you, friends.